Good afternoon, everyone, and welcome to today's webinar, Immunization Gateway Project Legal Agreements, Facilitating Secure Data Sharing for IISs, brought to you by the Network for Public Health Law, the Centers for Disease Control and Prevention, and the American Society of Law, Medicine, and Ethics. I'm Charles Strong, the Senior Digital Marketing Coordinator at the Network's National Office, and I'll be your host for today's webinar. A quick note that both the presentation slides and video playback for this webinar will be available on the network's website shortly after the conclusion of today's event. We strongly encourage attendee participation, so feel free to submit questions at any time during this webinar by using the Q&A tab on the right-hand side of your screen. All you need to do is click on that tab, select all panelists from the drop-down menu, and send us your question. We'll be addressing them towards the end of today's webinar. With that, I will pass things off to Kelly Carilli, who will be leading us into the rest of today's webinar. Kelly, over to you.
Thank you, Charles. This is Kelly Carilli. I'm a consultant with Audacious Inquiry, and I am covering for Jennifer Ratliff, who is with CDC today. So we are going to be covering the IC Gateway background, the IC Gateway use cases, a security overview, the legal relationships and data use agreement used for the IC Gateway, as well as the Public Health IIS Interjurisdictional Memorandum of Understanding. And at the end, we will have 15 minutes for questions and answers. All of the presenters make up IC Gateway team sponsors and team members. I am with Audacious Inquiry. We have CDC, HHS, the Network for Public Health Law, and the American Immunization Registry Association on the line today covering for the IC Gateway team. And we can go to the next slide. Okay, first we're going to start out with background about the IC Gateway. We can go to the next slide. So the IC Gateway is, in its simplest form, it's a intelligent message router. It's in a cloud-based system that facilitates the flow of data between exchange partners. Exchange partners include IIS, provider organizations or EHRs, and consumer portals. The IC Gateway does allow for bidirectional exchange of immunization data, and it is a centralized data exchange component that facilitates the flow of data. We can move to the next slide. This is our data exchange model. If you look at the right-hand side, you can see that this is typical immunization data exchange, where an organization within one jurisdiction typically sends bidirectional messages to one IIS. The IC Gateway intends to simplify that by having a hub and spoke model, where an organization will onboard to the IC Gateway for exchange with multiple IIS. We have different exchange partners such as federal agencies, multi-jurisdictional vaccination providers. This may be groups like skilled nursing facilities and long-term care, and then consumer access portals that may query for their historical immunization records through their applications. And this would go through the gateway to an IIS and return the message. We also have IIS to IIS exchange of data, so state A sending through the gateway to state B, and so on. We can move on to the next slide. Okay, moving on to the use cases, next slide. We're going to focus on two primary use cases for the IC Gateway today, and specifically the legal agreements and policy agreements that are necessary for participation within this type of exchange. So within exchanging data with provider systems, this would include groups like VAMs, federal agencies, and multi-jurisdictional provider organizations, such as skilled nursing facilities, long-term care, and other types of EHRs or provider systems that have needs for exchange of immunization data with IIS. VAMs is the CDC COVID-19 tool that is used by different states and systems for COVID-19 reporting, for anyone who's not familiar with that term. The second use case that we're going to focus on is IIS to IIS exchange through the IC Gateway. We can move to the next slide. So the first use case, as I mentioned, is provider systems exchanging with IIS. And this is critical for timely IIS data completeness and providers having access to complete and accurate immunization history at the point of care. So by facilitating and increasing the flow of data amongst IIS and between provider systems, the IIS can have more complete and accurate data and make that data more readily accessible to end users, including providers who are administering care, as well as consumers. To participate in this use case, the requirements are for the legal component are for the IIS to sign an Association of Public Health Laboratories data use agreement. In addition, there are jurisdiction-specific policy agreements with each agency or organization. So this is often an EHR or a system enrolling in a state-specific agreements that are needed for immunization data exchange. The testing for this component typically takes about 3 to 6 weeks with each agency or organization. Okay, we can move to the next slide. For use case 2, this is focused on IIS to IIS exchange of information, so jurisdictions exchanging with one another. And this might be an IIS querying another IIS for information or automatically sending vaccine information to a patient's home IIS through the IZ Gateway. This enhances completeness of IIS data within a system and makes that available for delivery of care. So for this component, we're going to go into the legal agreements extensively during today's session. We have the Association of Public Health Laboratories Data Use Agreement. We have the Shared Task Order. That is a appendix within the Data Use Agreement that jurisdictions must sign to indicate which use case they would like to participate in the IZ Gateway. And then we also have the IIS interjurisdictional MOU. For this component, we estimate that it will take 3 weeks to 3 months for testing, and that is outside of the legal agreements that have to be signed for this component. So I've started by giving you all an overview of the IZ Gateway use cases, and today we really want to focus on the legal agreements that have to be signed for participation within the Immunization Gateway use cases. And we've had great progress in the last year where we've had, I believe we're up to 45 jurisdictions have signed the interjurisdictional MOU, and it's on the slide later, but around 48 or 50 jurisdictions, I think, that have signed the DUA. I have the exact number on a later slide. But there are still some jurisdictions that haven't signed the data use agreement or the MOU, and we want today's session really to focus on those that have not signed and how we can support you with moving forward with the IZ Gateway. So we're gonna have a security overview next, but the legal experts that are on the line, Carrie Wagner and Denise Chrysler, are really available to everyone to ask any questions you may have about the legal agreements that are needed for the IZ Gateway in order to participate moving forward. Okay, and we can move to the next slide. Okay, I am going to hand it over to Dan Chaput, who is going to provide a security overview. Thank you.
Hi. I'm assuming you can hear me. On the next slide, you will see a diagram of how the data moves from, in this case, an electronic health record on the left, through the gateway in the middle, to the destination IIS on the right, and then returns back through the gateway, the response with the data, and goes to the EHR. The most important thing to recognize here is that in order to even get the IZ Gateway to produce any sort of meaningful response back, the system on the left, the originating EHR, has to have a certificate, an IZ Gateway certificate. So that certificate is approved by the Gateway staff and is issued by a certificate authority. It requires a notarized application. And you get basically nothing back without that certificate. So the average user, like attempting, should they even find the internet address where the gateway lives, is going to get nothing without this certificate. If anyone abuses the use, it's very simple to deactivate, revoke the certificate at any time and prevent that system from accessing the gateway. So that is a solid sort of door into the system in terms of security. Beyond that, inside there, the certificates, you may hear them referred to as X509 certificates. That is the international standard for these sorts of transactions. The other piece in here, TLS, is the transport security layer. Again, excuse me, another standard that describes how the data is actually encrypted when it's moving across the internet. So again, we're using all national standards. So I'm not going to dwell on this. There's other certificates and passwords as you go through the system. There can be some minor variation to account for what states need to do, but essentially it maintains similar security to what the state has in place today or something tighter. On the next slide, the only real difference here is that the transaction over on the left is originating with an IIS. So prior to this IIS to IIS data exchange, the IIS were only acting as servers, basically. Over on the right-hand side, they would react to someone coming in to say, I'd like to send you an immunization event, information about an event, or, a query to say, could you give me this individual's immunization data? Now, in this scenario, the IIS can actually start that process. So one IIS can act as a client, reach out to a second IIS through all of these secure pipes that we have here using the standard messages that are used for the gateway, and send the message back to the originating IIS. So one IIS can send a vaccine event across to another IIS, or can query another IIS. If someone really wants to get into the details of this, I can do a more thorough walkthrough if there are questions at the end. So the rest is probably well beyond the scope of legal sorts of things. On the next page, important thing to remember here, excuse me, the gateway is meets a number of standards. The most important of those is the FISMA moderate compliance. FISMA is the Federal Information Security Modernization Act of 2014. It was created by NIST, the National Institute of Standards and Technology, which is part of the U.S. Department of Commerce. So we comply to a whole set of standards that are described in that FISMA, the FISMA Act, and also conform to HIPAA requirements, which has another whole set of requirements. And underneath that, there's also another standard you may hear referenced, which is NIST 800, which is another level of standards. There are roughly sorry, hold on just a second. there are roughly 400 factors that need to be met in order to meet the NIST 800 requirements. So again, you know, and this all lives in APHL, the Association of Public Health Laboratories environment, so they provide a level of security. The systems themselves are in Amazon Web Services in their GovCloud, so there's all the security levels that are met for who has access to the servers, physical access to the environment. So they're all driven by these FSMA and NIST requirements, and also influenced by HIPAA. So the data passes through in motion. Basically, it is not detail information is not persisted anywhere. That means it's not printed, it's not stored, it's not displayed on screens. It's just passing through in motion from one IIS to another IIS. There is some metadata that is tracked. For example, what IIS invoked the transaction, where did it go, what time did it come in, what time did it go back out, just to keep track of the health of the gateway. So I think those are probably the most important parts. Along with that, the software itself. Is there another slide? Let me see. Could you go forward one? Okay, let's go back two. Sorry. Okay, so this piece in the middle, the IZ Gateway, there's also an independent third-party audit here. So an independent third party gets on, like acting like the originating IIS, and runs a penetration test. And this takes, hours, maybe 8 hours over the course of a couple of evenings, and tries every way possible to break into the gateway. First, by just trying without a certificate, and then even with a certificate, as if it was a known entity coming in, tries to basically break the gateway. The other thing that is done is that APHL and this independent third party and the developers themselves scan all the software to look at the versions of software that are running, so that if there's any version that has a known vulnerability, it's identified and that is fixed. So there are both penetration tests and software scans that are done continuously as major releases are done, and also just as code is released. And again, it's done both by a third party, APHL, and the actual gateway developers. So we can go back to the next slide. And then the next slide. Going forward. I think we're going backwards. Thank you. And let's see. Yeah, for multi-jurisdictional data exchange, there will be some decrypting of the information and parsing of information in order to provide that support, but that is not in production at the moment. On the next slide. In the event of a data breach, APHL has the responsibility for notifying the jurisdiction. So APHL, as part of both the agreements with the DUA and as part of the FSMA compliance, is the entity that will be responsible for notifying folks of any breach. And I'm all set, and I guess we'll hold questions for the end unless I hear differently. So passing back to the host.
Charles, I think I'm up, so you can go to the next slide. Hi, everybody. My name is Carrie Wagner. I'm a senior attorney in the Mid-States region at the Network for Public Health Law. And I'll give an overview of the legal trust relationships today, and then dive a little deeper into the data use agreement, as well as the legal agreements between jurisdictions and providers participating in the gateway. So our role within the project at Network for Public Health Law is to help facilitate and negotiate the various legal agreements that are needed for the various parties to participate in the IZ Gateway and send immunization to each other through it. Next slide, please. And one more as well. So I'll start with a high-level overview of the IZ Gateway legal trust framework, and then through the rest of the presentation, we'll kind of break down the various components. So in the middle there, you'll see that gear represents the IZ Gateway that's hosted by APHL. On the right-hand side, those blue globes represent the jurisdictional IISs. And then on the left-hand side, you have the provider organizations, so multi-jurisdictional providers that will be reporting, federal providers, et cetera. And then the various legal agreements between them. Those blue arrows that you see kind of throughout the middle represent the data flow. So again, going back to the middle, that gear, that IZ Gateway, and then on the sort of lower right-hand side, you have the data use agreement that's between the IIS and APHL on behalf of the IZ Gateway. That is your sort of baseline agreement in order for IISs to participate in the IZ Gateway project, is signing that data use agreement. And then moving over towards the right, you see the MOU. That is required for the IIS to IIS exchange use case, or you'll see in the data use agreement, it's referred to as share. And that is required in order for IIS to send and receive immunization data amongst themselves through the IZ Gateway. Going back over to the left-hand side and those provider organizations, the provider organizations, by and large, will be HIPAA-covered entities, and so they'll enter into a business associate agreement with APHL, where the APHL is acting as a business associate, moving that protected health information, whether reporting to IIS or querying IIS, and then returning the consolidated vaccination records to the provider. And then finally, the relationship between the provider organizations and the IIS jurisdictions. At the top are those jurisdiction-specific policy agreements, or JSPA. And what we mean by those are the particular agreements that each jurisdiction requires in order for a provider or another entity to access its IIS or IIS-related information. Next slide. So breaking down the sort of first component, the trust relationship between IIS and the IZ Gateway, is that data use agreement with APHL. It addresses a number of terms: security, the data exchange, and then there's a task order that I'll talk a little bit more about that allows jurisdictions to select what components of the project you wish to participate in. Next slide. So again, the data use agreement is that baseline agreement for IIS to participate in IZ Gateway. The parties are, again, APHL and your particular jurisdiction. The data use agreement's term is indefinite. So unless one party actually seeks to terminate or the project itself were to end, that data use agreement will go on. I won't go over security again, other than to say that it's outlined, the security requirements are outlined within the DUA. It's a modular data use agreement, which means that the jurisdiction selects which components you want to join. Again, ratification of the DUA enables participation in what we call Connect, or that use case 1 that we were talking about earlier, which is really the exchange of vaccination data from providers, allowing them to report to IIS as well as query. And then with completion and execution of the task order, you can enable other components such as IIS to IIS exchange. Next slide. So in terms of APHL's responsibility, they host the IZ Gateway, they'll accept and route the messages, they're responsible for creating the users and appropriate user access, offering support for the system, ensuring security and data access, as well as breach notification. And importantly, they have to flow down these terms to any contractors that they might engage with on the IZ Gateway. Next slide. And as a jurisdiction, your responsibilities are, to have staff available to create and maintain the environment, as well as verifying data flow and system messages. And if required, from a legal perspective, the jurisdiction would be required to make sure that you have all the necessary consents that are in place or required by law. Then we've included 2 links here that will allow you to, one, access the data use agreement template and review that, as well as an overview of the legal agreements, in addition to what we're going over today, which are on the network's website. Next slide. So the task order to the data use agreement, again, allows you to join components in addition to connect. We're focusing today on the share or the IIS to IIS data exchange, but the task order will also allow a jurisdiction to choose to participate in provider-initiated multi-jurisdictional exchange, where a provider might query multiple IIS, say if they have a patient who has lived in multiple states and been vaccinated in multiple states. And then there's consumer access components as well. And again, these are in development, but you can elect to join those there. And the task order also changes some of the terms in those cases, like the provider-initiated multi-jurisdictional exchange, for example, where APHL may need to access some message content in order to properly route the message and send back a consolidated vaccination record. Next slide. In cases where an IIS is HIPAA covered, APHL is also willing to enter into a business associate agreement where they'd be acting as a business associate on behalf of the HIPAA covered IIS to facilitate exchange of immunization information. We have a template data use agreement that we work off of for that, but just know if that isn't something that your jurisdiction needs to deal with, we do have a business associate, and that's another step in the process if needed. Next slide. We'll talk a little bit more, and you can advance that to the next slide, about that trust relationship that was on the top of the first diagram I went over between the IIS and the various provider organizations that will participate in the IZ Gateway. Again, you'd have those jurisdiction-specific policy agreements, which are each jurisdiction's, provider site agreements, user agreements, confidentiality agreements, whatever your jurisdiction requires. The provider organizations must agree to participate and exchange data with you. So as you can imagine, from a provider perspective, executing as many as 64 for all the various jurisdictions represents potentially an unwieldy amount in terms of your own compliance. So the team is currently working on streamlining individual jurisdiction-specific agreements into a more common agreement, kind of modeled off the interjurisdictional MOU that my colleague Denise Chrysler will talk about in a little bit. Just know that that's out there. That's something that we're working on. Right now we'll just be having the providers into those jurisdiction-specific provider agreements, but kind of more to come on streamlining that. So watch out for that in future. Next slide. So again, this is just a visual representation of the legal agreements that are needed for exchange with provider systems through the IZ Gateway. Again, now at the bottom, you've got that gear that represents the IZ Gateway, and then the DUA moving up to the upper right-hand corner, you've got the IIS. Across the top, those jurisdiction-specific agreements for each jurisdiction that the provider organizations will sign. And then moving from the left, the provider organizations back down to IZ Gateway, you have the business associate agreement. So you can see the 3 parties there and the 3 legal agreements that make up the legal trust framework and that provider exchange scenario. Next slide. And with that, I will turn it over to Denise Chrysler, who will talk more about IIS to IIS data exchange and the legal agreement there.
Thanks, Carrie. Hello, everybody. This is Denise Chrysler. I am Director of the Network for Public Health Law's Mid-States region. Thank you for joining us, and I will be covering the agreements that provide for exchange of immunization information between IIS. In the DUA, Carrie mentioned and described the term share is used, which refers to IIS data exchange. Next slide, please. When a healthcare provider vaccinates an individual, the provider then reports the vaccination information to the IIS, where the individual, where the vaccination is administered. And this reporting is to the place where the vaccine is administered, regardless of where the individual lives. So the Immunization Gateway provides an infrastructure, first to streamline reporting by multi-state provider organizations to the appropriate IIS. And then it also provides an infrastructure to facilitate exchange of immunization information among IIS so that a complete vaccination history is available to the provider at the point of care. The IC Gateway routes this information between jurisdictions that have a relationship with a vaccinated individual. And to provide for this exchange, the jurisdictions signed the Public Health IIS Interjurisdictional Memorandum of Understanding. And that MOU sets out the terms for the trust relationship between the individuals. Next slide, please. So the IIS exchange, IIS to IIS exchange, involves two trust relationships and legal agreements. As Carrie mentioned, the agreement, the DUA with APHL, and then additionally, the jurisdiction needs to assign the MOU. Next slide, please. The MOU then provides for the secure electronic exchange of information among governmental entities that operate a population-based IIS. And to complete the MOU, Carrie already pointed out the URL where you can download the fillable form from the ERA website. And then once you execute the MOU, you need to provide the executed MOU to ERA. Next slide, please. A little history about the MOU. It was first developed in 2015. At that time, large numbers of families were moving from Colorado, Idaho, Michigan, and Minnesota to North Carolina to work in the oil fields, but their immunization information wasn't moving with them. And this made it difficult to keep children current on their vaccines and also to ensure a complete vaccine record that's needed to enroll in school. So immunization managers for these 5 states, along with Wisconsin, worked with the Association of State and Territorial Health Officials, as well as the American Immunization Registry Association, to develop an agreement that would facilitate exchange of immunization information among jurisdictions, again, concerning individuals who have or have had a relationship to the individual. By exchanging information, this ensures there's a complete vaccination history for individuals who move between jurisdictions, cross borders for care, are vaccinated while traveling, live and receive vaccinations in multiple states or jurisdictions, such as individuals in the military, college students, migrant agricultural workers, snowbirds, or prisoners, and also for individuals who are temporarily displaced because of a disaster or emergency. Next slide, please. IIS exchange is critical to the COVID vaccination efforts. In signing the MOU, jurisdictions can satisfy themselves and confirm to others that they are able to exchange immunization information with other jurisdictions. I mentioned, I believe, that the MOU provides the rules of the road. It provides terms and conditions for exchange among 64 jurisdictions. So uniformity and consistency are crucial. 45 jurisdictions have already signed. ERA administers the MOU, and it maintains all signed copies and provides a members-only portion of its website related to the MOU that has all the signed copies. There are 3 versions of the MOU, with the July 2020 being the current version. We crafted the versions so that these MOUs work together and parties agree to common terms. If your jurisdiction has already signed the MOU and it's not the 2020 MOU, you don't need to re-sign. But that said, if your jurisdiction has signed the 2016 MOU, the original one, we do encourage you to re-sign so that we have parties either on the 2019 or 2020 versions, and we can retire the original version. The MOU is flexible, it's technology inclusive. It, along with the DUA, covers exchange of immunization information via the IIS Gateway. It also recognizes that some jurisdictions started exchanging information before the IIS Gateway was established, and that allows jurisdictions to maintain or create point-to-point connections. Next slide, please. As I mentioned, 45 jurisdictions have already signed, and here's a list of the state, territorial, and I believe one city or one regional jurisdiction that's signed. Next slide, please. Some key MOU provisions. The parties to the MOU are the original parties and additional and future parties that provide signed copies to ERA. The purpose of the MOU is set out, and in the MOU it states that you, as the recipient of immunization information from another IIS, will use this information only as set out in the MOU. As I mentioned before, the MOU is not intended to eliminate current or future point-to-point agreements. The MOU also has the sending party, the IIS that sends information to another jurisdiction in the driver's seat regarding the immunization information that it provides. And the language is summarized here. Next slide, please. Upon receiving the immunization information, the receiving party would incorporate the data into its IIS just like a provider would with its electronic case record. And then this information is subject to the receiving IIS's control. The receiving party must use and provide this information consistent with the purpose in the MOU and all the terms of the MOU, and then of course must comply with its own law with regard to immunization information. There's a provision about the parties implementing privacy and security safeguards, also a provision about no warranties about the information, although parties are required to use their best efforts. Next slide, please. As with any agreement, in signing the MOU, your attorney's starting point may be to look at your jurisdiction's legal authority to exchange immunization information. We know there is a lot of variation in state law. Some states may have explicit laws that allow jurisdictions to exchange information with other jurisdictions, or they may have this covered with general law, the general powers and responsibilities to prevent and control disease. For some jurisdictions, they have provisions, and a lot of jurisdictions have provisions for emergency powers to exchange data during a pandemic, but it's always best to be able to exchange information routinely so that information is available at the point of care. We are available if you're concerned about your law appears to be restrictive, to discuss your legal concerns, including with your attorney. We might be able to assist you in identifying potential approaches that would support immunization information exchange. And then just as a reminder, you need to sign the DUA with APHL, and that provides the infrastructure for secure IIS data exchange, and it addresses security safeguards such as encryption and breach notification. Next slide, please. Here we have a large project team. Here are all of our partners, the Centers for Disease Control. This is a CDC project, and it is the sponsor of the project. Next slide, please. Just to mention, the Network for Public Health Law is a national program, and we provide legal assistance to assist attorneys and their client agencies to share meaningful data to improve the health of communities, including to make sure that people are vaccinated, fully vaccinated. This presentation should not be considered legal advice or representation, and we urge you to consult with your attorney. Next slide, please. If you have questions about the IZ Gateway, please email the CDC at izgateway@cdc.gov. Next slide, please. And now I'll turn it over to Charles.
Thanks, Denise, and thank you to all of our great speakers today. I'm actually going to pass it over to Mary Beth, who will be facilitating the Q&A. And if anyone has any technical issues, feel free to reach out to me. To submit questions, again, it should be on the right-hand side of your screen. You click on the Q&A tab and submit your question that way. Mary Beth, over to you.
Great, thanks very much, Charles. So this is Mary Beth Carrillo. I'm with the American Immunization Registry Association, and I'll be fielding questions today. And thank you to all of you who have already put questions into the chat box and the Q&A section. I do want to just get one housekeeping issue out of the way, and that is several folks have asked if the slides and the recording from today's presentation will be available, and yes, those will be linked on the Network for Public Health Law's website. So you should be able to access these after the call. So I will go ahead and take the questions in the order they came in and direct them to the most appropriate panelist, but certainly other panelists can feel free to answer as well. So to start with, I think it's a question probably for Denise or Carrie. When navigating the complex variety of state laws that govern healthcare data usage, what are some strategies you've used to help navigate common barriers and increase collaboration, despite how siloed people can sometimes be?
Sure, this is Denise. When I'm looking at state laws or territorial laws and what they permit for data exchange, I first go to specific laws. Here it would be if the jurisdiction has explicit laws with regard to immunization information and who that information might be shared with, and especially with regard to other public health agencies or other jurisdictions. Lacking that and having specifics, then I go to general law about that would govern sharing of information for disease prevention and control. I mentioned that the jurisdiction that sends the information is always in the driver's seat. It is the jurisdiction that decides whether any prerequisites are met in order to provide information to the other jurisdiction. And I think that answers. Carrie, anything more?
No, I think you covered it.
Great, thank you, Denise. And I will just add to that too, that I think one of the things we did really early on when we were rolling out the MOU was piloted that with 6 jurisdictions who were really engaged. And I know, Denise, you painstakingly worked with legal counsel and program staff from all 6 of those jurisdictions to work out some of the kinks and really address those questions and anticipate additional questions that would come up as we tried to roll it out nationally, which I think was a really important strategy and really saved us a lot of time in surfacing those questions early so we could address them early, and then that didn't interfere so much with the national rollout. So thank you for that. Okay, the next question up in the queue is, and this was, I think, loosely addressed by what Carrie mentioned, but I'll just ask Carrie if you have additional thoughts about this. What is the connection between the IZ Gateway data use agreement that jurisdictions signed last year and the IIS MOU provided by ERA? Does this depend on the level of participation chosen in the DUA? So I know you covered that the MOU really addresses IIS to IIS exchange, and the DUA is a little bit more broad. But do you have anything more you want to add about that?
Sure, just briefly, I think, as Denise mentioned, the MOU was actually developed prior to the IZ Gateway project to facilitate the exchange of data between, various IIS. And we just utilized that in the legal framework for the IZ Gateway. So there could be jurisdictions, and I think there are jurisdictions who are exchanging maybe in a point-to-point connection between two IIS utilizing the MOU. But for purposes of the IZ Gateway, you'd need that DUA in place with APHL, and then if the jurisdiction through the IZ Gateway would like to exchange data with another IIS jurisdiction, that interjurisdictional MOU would need to be completed.
Great, thank you so much. All right, the next question is one that I think I can field, but would be open to anything else that the panelists want to add. The question is, by originating provider EHR, does this contemplate only large providers, for example, Bureau of Prisons and Department of Defense, or would all providers, such as someone's local PCP, be expected to use this and get a certificate? One of the overarching approaches of the IZ Gateway is it doesn't want to disrupt active, ongoing, successful interfaces. So what that means is if a provider site is already submitting data to and querying from their local IIS, the IZ Gateway doesn't want to step in there and reroute that, that interface. Rather, this is really for some of those large provider organizations, the federal entities who to date have not submitted to IIS. And certainly if there was a large provider organization that spanned multiple states that decided the IZ Gateway was a better option, then that would be considered. But it really is trying to address some of those data feeds that have not to date been coming into IIS and some of the query relationships that haven't yet been created. So Kelly, is there anything you want to add about that from the IZ Gateway perspective?
No, sorry, I don't have anything to add to that. Thank you, Mary Beth.
Okay, great. All right, then moving through the queue. Let's see, the next question is about consent. So basically the system allows a person to get vaccinated in one jurisdiction and allows tracking. It seems the administrative jurisdiction from federal agency to agency. That's the equivalent or sharing with state administrative arms and jurisdiction. Does the vaccinated person understand and expressly consent to participation in the sharing of vaccination? And then in parens, a quasi-vaccine passport system.
I think I can answer this. I hope I understand the question. IIS have been around since the 1990s. We do not have a national IIS. Rather, each jurisdiction, be it a state or territory or city, has developed in accordance with its own laws, IIS. These IIS have a variety of ways that data are reported. In some jurisdictions, it's mandated to be reported regardless of whether the individual consents. In other words, the legislature has made a decision. This information is so important to have at the point of care that it's provided in that fashion. Many jurisdictions have opt-out that you participate in the IZ Gate, or I'm sorry, not the IZ Gateway, in your IIS, unless you have opted out. And then a few jurisdictions have an opt-in. You need to affirmatively consent. And then you go, once the IIS has the information, looking at to what extent does the law allow information to be provided to other jurisdictions. And that's to accomplish the whole purpose of making certain immunization information is available at the point of care. And I should mention, it's not just to see if somebody needs a vaccination, but if somebody may already have that vaccination, and it's very important to also prevent duplicate vaccinations. With regard to opt-out systems, you need to make sure that your jurisdiction is prospective in the sense of somebody says originally was part of the IIS and then says, I don't want my information shared anymore, an IIS can't go to all the providers or all the IIS that have already received that information, but prospectively would then not provide immunization information to IIS or to providers. So Carrie, do you have anything more on that?
No, I think you covered it.
Great, thank you. Okay, so the next question is, are these MOU and other legal agreements only regarding those transferring from one state to another, for example, Indiana versus Illinois, rather than interstate, for example, Chicago versus Carbondale? And I will say we do have jurisdictions who have signed at the city level and the state level, but Denise, do you want to add more to that?
Sure. It covers governmental population-based IIS. Every state has a state IIS. I think most territories do. The District of Columbia does, and there are just California has regional IIS. And then there are just a few cities. Carbondale is not one. I know Chicago has had an IIS in the past. I don't recall if it still has an IIS.
Yeah, and in Chicago's case, they actually use their state IIS, but I think Philadelphia and Pennsylvania could be a good example of that, or New York City and New York State. And I will say that this does not preclude a point-to-point exchange. So for example, New York City and New York State have had a long-standing exchange of data. And this wouldn't force them to send that through the gateway if they already have a functional exchange from IIS to IIS. Okay, the next question is, and I think this is in reference to something either Denise or Carrie said, can you say more about how the sending IIS is put in the driver's seat with regard to the information it sends? For example, if an IIS's law only allows disclosure of certain data fields, could the IIS decide to only send specific pieces of information to other jurisdictions? For example, patient name, vaccination date, or is there a standard minimum set of fields that IIS need to be able to send to each other?
Yeah, this is Denise. The CDC has defined core data elements that IIS should have. Some are optional, some are required. But when it comes to actually one IIS sending information to another IIS, there are laws that only allow certain information to be collected, and also laws that only allow certain information to be provided. So the IIS that provides the information is in the driver's seat as to what it provides to another IIS, and would need to know what it is permitted and not permitted to do.
Great, thank you, Denise. And we are just a minute or so shy of the top of the hour. So I will say we can field the rest of the questions that are in the queue and try to get back to the participants in writing. So we'll take that as a follow-up item, but I want to make sure I leave enough time for Charles to wrap up. So over to you, Charles, and thank you very much, everyone.
Thank you, Mary Beth, and thank you again to all of our speakers for your great insights today. Just a few final notes. All attendees will be receiving an email from the network with the video playback of this webinar, as well as a link to our brief webinar survey. The survey takes just 1 minute to fill out and provides us with some really great insights. You will also be receiving an email from ASLME with information on how to apply for CLE credits for this event. And finally, join us for the 2021 Public Health Law Conference this September in Baltimore. We plan on hosting a hybrid event with an in-person component for all vaccinated registrants and some tracks that will be streamed online as well. So learn more by going to phlc2021.org. And that concludes today's webinar. So thank you all for attending and have a great rest of your day.